decides that I'm an object and does unspeakable and tragic things to me, am I a child supposed to carry and birth another child?
We've been in a constant battle against a government and healthcare system which does not care about protecting healthcare workers or providing patients with access to the full range of healthcare they have a right to.
No one should be prosecuted for the outcomes of their pregnancies, whether it is a miscarriage, stillbirth, or an abortion. Immigrant children are caged apart from their families. Trans children are turned into political fodder. Young students are murdered in their schools, and Black and brown parents live in anxiety about the day their children encounter the police. These issues are not separate from abortion. They are the realities we consider when weighing whether we want to bring another life into this country. Despite the abortion bans, many people are and will still get abortions, but far from home and at great expense. I care for them regularly. I am one of the many thousands of volunteers with local abortion funds who receives them into our cars, our homes, and communities. This community care is being criminalized, not because it is wrong, but because anti-abortion legislators think it's a good policy to criminalize Americans showing up for each other. No one should be prosecuted for the outcomes of their pregnancies.
Graham, what would you say to somebody like me who found out that their son had an anomaly that would make him incompatible at life in 16 weeks? I had regular appointments, I did everything right, and at 16 weeks we found out that our son would likely not live. When he was born, he lived for 8 days. He bled from every orifice of his body, but we were allowed to make that choice for him. You would be robbing that choice from those women? What do you say to someone like me?
We're going to join the rest of the world and not be like Iran. As to your particular case, there'll be exceptions for life of the mother and rape and incest. But
I'm 12 years old. I attend Buffalo Middle School. I play for varsity volleyball, and I run track. My education is very important to me, and I plan on doing great things in life. If a man decides that I'm an object and does unspeakable and tragic things to me, am I a child supposed to carry and birth another child? Am I to put my body through the physical trauma of pregnancy? Am I to suffer the mental implications? A child who had no say in what was being done with my body. Some here say they are pro-life. What about my life? And does my life not matter to you?
I could say a lot about my thoughts on criminalizing abortion as a person who is able to bear children, but I figured I'd use this time to offer the perspective of a physician. I'm not sure if you've noticed, but our healthcare system is collapsing around us at an alarming rate. We've already been operating under tense and scarce conditions prior to COVID-19, trying to survive and practice within a profit-driven healthcare system, but since 2020, working in healthcare has felt like fighting in a never-ending war zone. There's no doubt about it that abortion is healthcare, none at all. In many cases, it's considered the standard of care and part of the practice of evidence-based medicine. Pregnancy is a physiologic state which changes how a person's organs function, how their hormones function, and there are many medical conditions in which pregnancy is contraindicated and carrying a pregnancy to term can be fatal. Patients will die, they're already dying, and physicians and nurses will be arrested for trying to save them. After almost 3 years of healthcare workers having to watch patients die in waiting rooms, in their homes, in ICUs, isolated from their families and friends for no good reason at all, I don't think many of us can take watching our pregnant patients needlessly die because the government won't let us practice the standard of care.
Give us back our abortions at any time and for any reason, anywhere in this country. Thank you.